Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Stephanie Desmond. Today, I turn the tables on my co-host, Dr. Josh Sharfstein, who leads the Bloomberg American Health Initiative at Johns Hopkins, as we discuss a new report on the decline of life expectancy in the United States. Average life expectancy has dropped precipitously since 2019 for reasons that go beyond the COVID pandemic. He tells me how we can reverse the trend. Let's listen. Josh Sharfstein, thanks so much for joining me.
Thank you for having me, Stephanie. Great to see you.
I wanted to talk today about life expectancy and a new report that you at the Bloomberg American Health Initiative have released on the decline of U.S. life expectancy. This is pretty unprecedented, is it not?
So in 2021, the average life expectancy in the United States was 76.1 years, which is down 2.8 years from the peak in 2014. It's an enormous decline. We haven't seen this kind of decline since World War I and the Great Influenza over 100 years ago. And so myself and a whole bunch of faculty actually at the School of Public Health who are involved in the Bloomberg American Health Initiative put our heads together to say, well, what can we do? What's going on? What are the reasons for this historic decline and what can be done?
So I guess we should start by reminding people of sort of what the landscape looks like. So what has caused this unprecedented decline?
So, the obvious top answer, if this were a game show, number one, people should get pretty quickly is COVID. COVID didn't exist in 2014 at the peak. Since then, we've had kind of a stalling of life expectancy increases and now this sharp decline. But COVID's not the only thing responsible. In fact, if it were just COVID, you would have expected life expectancy to keep going until, keep rising until 2020 and then start to fall. In fact, it was starting to fall a little bit well before 2020. And the reasons include overdose being probably the number two on that list. Heart disease, stroke, and diabetes have claimed more lives. They are together, at the top of the list for the most deaths in the country. And that problem has been getting worse. We've also seen increases from firearm, suicide, and homicide, and motor vehicle crashes, among other topics. So it's a list that goes beyond COVID. And that means that the slowing of the pandemic is going to be somewhat helpful to life expectancy, but we're still falling relative to a lot of other countries. And until we can pull it together across a whole bunch of different health issues, we're not going to start to climb again as a country from a life expectancy perspective.
It's just startling how much it has fallen in a country that's, touted as having the best health system in the world. And so how did this happen and why weren't we paying enough attention to prevent it?
Well, it has wiped out the life expectancy gain since the mid-1990s. It's an enormous decline. And we do have certainly the most expensive healthcare system in the world. We have wonderful care for a lot of patients and not enough care for some patients in this country. And our healthcare system is very, very focused on providing healthcare to sick people and not very focused at all on keeping people healthy. And so if you are providing great healthcare to very sick people, you're doing them a service, but you're not necessarily increasing life expectancy overall. You really get life expectancy increases overall from investing in prevention so that the people who actually get sicker are older. And that we don't do a very good job of at all. We spend 97 or 98% of every health dollar on health care and only a very little bit on public health and the kinds of investments that would really make a difference.
Mm-hmm. The conversation you mentioned, heart disease, one would think that we know how to prevent this and that should not be a factor here. Why is that happening?
Well, there are a number of different reasons. Among them are the enormous disparities and inequities that exist in our society. Some people are able to have fresh fruit all the time and vegetables on demand. Other people, they could walk for miles and they can't find any, and so they're stuck eating highly processed foods, which frankly can contribute to heart disease. And they may also not even be able to walk miles in every direction because it's not safe or they don't have places to walk. And so that also contributes to heart disease. So there are a number of communities, places where access to the core, resources that make for health aren't there. That access isn't there. And as a result, we pay the price in life expectancy. And particularly those communities pay a very steep price.
So the CDC data, did it tell you anything about racial disparities in terms of life expectancy?
Well, the decline in life expectancy has not been the same for all racial and ethnic groups in this country. The most significant decline was among Indigenous people on the census classification as American Indian Alaska Natives. Their life expectancy dropped more than 6 years during the pandemic to 65 years. 65 years. And remember, I said the overall was 76.1 years. There was also a very significant decline among Black Americans, down to 70.8 years, larger than the overall decline. Those are the two groups that were most significantly impacted in this way.
So how do we fix this? What are the solutions?
So each of those different causes, those preventable causes, has specific ways to be fixed. If you start with COVID, which is still killing hundreds of people a day in this country, we can increase the rates of our vaccination coverage. We can get people treated more quickly. I was very disappointed to see that Congress did not provide more funds for the COVID response because, as we now know from a new variant that's been circulating quite intensely in the Northeast, COVID's not done with us, and we will remain susceptible until we are able to do everything that we can do to fight it. And so I'm hopeful that with the continued pressure of the pandemic, that we do get updated vaccines, updated treatments, more access to treatments, more attention to equity in who's getting those treatments, and that can reduce that toll. Moving on to overdose, there are a number of things that are really important. It's still the case that something like 85% of people with, for example, opioid use disorder do not get the most highly recommended medications for treatment. And that is in part because of trouble accessing them in the healthcare system. Emergency departments in many places don't offer them. Doctors don't do that routinely in many places. Hospitals may not start people on treatment. And we need to make a treatment a much more consistent and regular part of medical practice. Another recommendation from our faculty, and each of the recommendations in the report is attributed to specific faculty members here at the school, but another recommendation is to really expand access to harm reduction services. Fentanyl is extraordinarily dangerous. Not everybody is able or interested in getting treatment right at that moment, but there are other types of services that can save their lives, naloxone, Narcan being one example, and then create relationships that help move people closer to treatment, closer to recovery, and ultimately out of harm's way. So really investing in those kinds of services is extremely important and no question can save many lives in this country. I could keep going if we want to talk about gun violence a bit.
Sure.
So we've had a great team of faculty put together some recommendations on gun violence. Among them, that states should adopt popular policies that reduce gun-related homicide and suicide, including what are known as extreme risk protection orders and permits for gun purchase. These are state policies that have been evaluated and shown to be either very promising or very clearly linked to declines in homicides and suicides. This idea of extreme risk protection orders, we've talked about on the podcast before, allows when somebody is in an unstable situation and has a gun, it allows for the gun to be removed temporarily from their possession in order to keep them safe and keep others safe. In addition, on violence, there's a recommendation for cities to strengthen and expand community violence intervention programs. These are community-based programs which often support local groups to send the message about how to resolve conflicts without violence and reduce disputes that exist in communities, kind of intervene, mediate disputes directly in some cases, those kinds of programs also work. And those programs are getting some money from the federal government, and it's really going to be up to states to take advantage of those resources and use them well. In addition, there's a recommendation on teen suicide particularly. Teen suicide can be with guns. It's often through other mechanisms. And our recommendation there includes that schools should invest in easily accessible, confidential, and comprehensive adolescent health care so that young people have a place to turn if they're really feeling desperate. There are a whole bunch of other recommendations for improving mental health services and care for young people and to prevent them from being mistreated by systems that they're encountering, which contributes to inequitable outcomes. So there's a lot packed into a short report here, Stephanie, but these ideas come from professors who have spent many, many years studying them, often where there's evidence and momentum that these policies and programs can make a big difference.
It seems this list feels in many ways insurmountable, even though you've given these great suggestions on what we can do. They sound like they cost a lot of money and need a lot of political will. So how do you foresee this issue going forward?
There's no question that the savings of keeping people alive, particularly young people, far exceed the cost of these proposals. And they have been implemented in different parts of the country. This is not like a science fiction report. Could you imagine in America where we do this? There are a lot of places in America that do these things. There are states, both red and blue, that have implemented these extreme risk orders around guns. The report is basically saying, let's prioritize addressing this decline in life expectancy. Let's find the things that some parts of the country are doing well and really take it to scale, make it available to everyone, put policies in place everywhere. If we do that, there are so many lives to be saved. So I look at this and I am not filled with frustration and nihilism. I am actually experiencing some hope because we have great reasons to believe that there are things that are being done and can be done more that can make a big difference for this country. We just have to pull it together, prioritize our own lives, and do them.
How quickly do you think we can turn this around?
Well, I think we're going to see some improvements because of the decline in the number of deaths from COVID, even though it's still way too high. I think we're probably also going to see some improvements from overdose because some of the more recent trends suggest a slowing of the overdose crisis a teeny bit. I think that some of the policies that are now getting put into place could make a much bigger difference on overdose. I think we'll have to see what the next couple of years bring to that and how many places are really ready to invest in the kinds of services that have evidence behind them. On guns, people's predictions about what the U.S. will do are often wrong. A lot of people say, oh, it's not possible. It's not possible. The NRA is too powerful or whatever the excuse is. But then we've seen that states, red and blue, will pass laws with evidence behind them. And that people, by and large, even gun owners, have very, very high levels of support for policies that would make a big difference. So I think that the response to these policies can be quite swift. We are going to have to also, though, build a longer-term agenda around equity that's going to be necessary for some of the more deeply rooted differences that exist, for example, between groups. So I'm not saying they're quick fixes. I think there are some things, though, that could make a difference in the short term and build momentum for the longer term effort.
Josh Sharfstein, thanks so much for joining me.
Thanks for having me, Stephanie.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.